Hi, my name is Dr. Sugg. I work here at the University of Iowa as a surgical oncologist, and I will spend a few minutes talking to you about nipple-sparing mastectomies. I'd like to first talk about the different kinds of mastectomy that we do. So a conventional mastectomy without reconstruction is where we remove the breast, and an incision is usually made like this. We take quite a bit of skin, and I'm just, for the purposes of illustration, doing it on both breasts. At the end of the surgery, both of the breasts are removed, and there's an incision going across like this. So for a skin-sparing mastectomy, what we do is we try to save as much skin as possible. And this is done in conjunction with reconstruction. It leads to a better cosmetic result and a more natural appearing breast. So with skin sparing, what we do is we usually remove the nipple. Let's say we have a tumor that's very close to the skin. Let's say the tumor is here, for instance. We might remove the skin over the tumor and the nipple, and then we save as much of the skin as possible. And then when the plastic surgeon comes in, they'll reconstruct the breast mound, and then they'll close the incision like this. This incision might be a little bit longer because we've taken out some skin. And then later on down the line, they can reconstruct a nipple. So then with the nipple sparing procedure, what we do is we save the nipple. We can perform the surgery through several different incisions, and the ideal incision really depends upon the location of the tumor, if there is one, and on the patient's breast. So we can do an incision along the side like that, or we can do an incision laterally. And this lateral incision is a really nice incision because really if you look at yourself from the front, you can't see the incision in most people. We raise a skin flap that's pretty thin, but thick enough to preserve the blood supply to the skin. And then we also core out the nipple. Okay, so we try to remove as much of the ductal tissue as we can, and we usually also will test this, especially in the case of a cancer, to make sure that there's no cancer in this nipple itself. And if there is, we do end up removing the nipple because we don't want to leave any cancer behind. The benefit really is purely cosmetic, and the nipple that remains after the surgery is not able to feel anything. It's completely numb. It's really mainly for the looks of this. This would be the breast in cross-section, and with the nipple sparing procedure, you would maintain this contour of the nipple. If we remove the nipple, as in the skin sparing procedure, what you do is you basically remove the top, and so the contour of the breast is less natural. And then even when you get a nipple reconstruction, we restore some of that, but nipple reconstructions are, although very good, not a perfect reproduction of the native nipple. Not everybody is a good candidate. Those individuals who are having prophylactic mastectomy would be great candidates. There are people who are at very high risk for developing breast cancer, and they want to have their breasts removed. For people who already have cancer, we want to have tumors that are away from the skin and at least 2 centimeters away from the nipple, and also smaller tumors. The nipple sparing procedure is a great procedure. It's not a procedure for everyone. It does have its potential risks and complications, and but for the right person, it can be a really cosmetically satisfying outcome for both the patient and the physician.